Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today is Monday, April 27th, 2026, 2-6. Today I'm redropping part 2 of the podcast I recorded with Dr. Tracy Agnese, who is a wonderful pediatrician. In part 1, we talked about the first few days of newborn care after birth. Today, in part 2, we're going to talk about care in the first few months. All right, once again, shout out to our new sponsor, our corporate sponsor, Play It Again Sports in Paramus, New Jersey. For those of you who live near or in Bergen County, check out Play It Again Sports on Route 4 in Paramus, where you can buy new or used sporting equipment or bring your own used sporting equipment to the store to sell to them for cash or store credit. They are officially opening in a few months, but as of now, you can come by the store to sell them your used sports equipment. They are there Monday through Saturday from 10 a.m. to 8:30 p.m. The store is rebuilt and looks great. Come by and check it out. You can also follow them on Instagram. Play It Again Sports Paramus, all one word. All right, thanks for listening. We'll see y'all next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. In, let's say, that first, week or half week of life, so, between birth, going home from the hospital, and that first visit, what do you find are the most common things parents are worried about that you're reassuring them?
Mm-hmm.
Like, this is normal, that's normal, that's normal. Because that must happen all the time.
Mm-hmm.
I mean, we're parents, we worry about everything. So what are the top things that you found? Again, in just those very few first days of life.
Yeah, sure. So there's a lot. I could probably go on and on. So stop me if I say too many. But one would be hiccups, right? And the babies have hiccups in the mom's belly as well. But they have hiccups after, and parents get really concerned about it. I always like to tell them we don't know exactly why. Irritation of the diaphragm, immature neurological axis, but it bothers the parents more than the baby. And it's fine. It's nothing to be concerned about. Sneezing is a really common one too. So
really?
Yeah, babies sneeze a lot, and they actually are congested in their nose, and those are two really common things that doesn't alarm me, but always alarms new parents.
Right. There's like bubbles coming out of the nose.
Mm-hmm. Yeah. They always think, does the baby have a cold? But their nasal passages are really narrow. They're really thin. They're small. And they also are clogged with debris from, birth and delivery and everything. And sneezing is a good, normal, healthy reflex of you to try to get that out. So it's normal that they sneeze. You don't have to do anything about it. I usually tell them, it's same with congestion. But if the congestion is making the baby have a hard time breathing or feeding, then you could do a little saline, over-the-counter saline drops in the nose, use one of those fancy snot suckers and suck that snot out.
A fancy snot sucker.
Oh yes, a fancy one. Yeah. The one there's the bulb syringes that that they have in the nursery, but those are really hard to use and not much usually comes out of them. So the fancy snot suckers are the ones that you actually put your mouth on. You're looking at me like you might not have used these. They're actually really
definitely not.
Most parents are grossed out by them. Some are not. I find it so rewarding to get that snot out. But so you put your mouth on it and you suck in. It's connected to like a straw or like a long tube, and the other part of that tube looks like the traditional little bulb syringe that goes inside.
You're just siphoning the snot out of your kid's nose?
Yeah.
Well,
There's
filters, that's like mother bird chewing their kids. No, we definitely had our kids in primitive times where that was not done.
You missed out.
Wow, that's impressive.
It's rewarding to get that snot out.
There's nothing similar for that for constipation.
Well, they do make a product, but you don't have to suck it out. Yeah.
Oh my God. All right, fine. I'm learning a ton here, by the way. This is great.
Snot suckers. So congestion, sneezing, they're always concerned that the baby has diarrhea, like I said, and just reassuring about what poop looks like. And then being really sleepy, difficult to wake up for feeds is really common in the first 2 weeks. We're talking
about one of the parents or one of the kids?
Parents are very sleepy too.
I just can't get woken up.
I can't wake the mom up. She's so tired. That is super common.
Yeah.
And the babies are usually really sleepy for about 2 weeks. And then about 2 weeks, they kind of wake up. So it's common that you have to really fight to keep that baby awake for a feed in the beginning. You can always, I find that people tend to make the baby too cozy too. So in the beginning, when you are struggling to, keep your baby awake to feed, you want to unclothe your baby. Don't be feeding the baby all in like a blanket cozy near you with the temperature temperature up. You might need to make it colder. You might need to have your baby naked. You might need to stimulate the hands and the feet.
Right. Do you believe in that adage about not waking a sleeping baby, or is it? Yeah. How do you address that?
Not in the beginning. I don't think any pediatrician in the beginning, in those first 2 weeks, would say don't wake a sleeping baby. So once babies get back to their birth weight at about 2 weeks is usually when we say that it's okay not to wake your baby. But they are so sleepy in the beginning, and they need to feed often because their tummies are just so small that they can get dehydrated and get sick fast if you don't wake them. So you do need to wake them so that there's no more than 3 hours from the beginning of one feed to the beginning of the next feed.
So you're saying you would agree with that statement, but only after they're 2+ weeks, give or take.
Exactly. So once they back up to their birth weight and they're otherwise growing fine and there's no concerns, then it's okay.
Okay,
although I usually do around that time tell the parents that, babies still can't do very long stretches of sleep, and so maybe they'll do 1 or 2 longer stretches, and long is,
4 hours.
Like 4 hours, 5 hours. If you do want that long stretch of sleep to be at nighttime, you might want to wake your baby up during the day so that you don't get that long stretch of sleep in the middle of the day.
Yeah, that first time you get that 4 or 5 hour stretch, it's such a blessing.
Magical.
It's unbelievable.
Yeah.
It's just like a gift from God.
Yeah.
Because you've been up every 2 to 3 hours for 2 consecutive weeks, and then suddenly you go to sleep at midnight and you wake up at 5,
and it feels so
and of course
good.
you always check, is my baby alive? That's like the first thing that happens, oh my God, who fed the baby? And then it's an amazing thing when that happens.
Yes, it feels very good.
That is pretty good. Okay, so those are some of the common things that are not a concern. What would be maybe not common, but what would be the things that would be concerning that could happen in the first few weeks? Things that you would be concerned about as a pediatrician?
I'll kind of answer this with both common and not common, but spit up is common, right? As babies spit up a lot. But if your baby is, throwing up like what we call projectile, like where it's shooting out across the room.
They're throwing it at you.
Yeah. That would be something you would want to call your doctor about. That would be concerning. Of course, if you ever see blood in the poop, I always say that poop can be many different colors, like of a shade of a tree, brown, green, orange, but you don't want to see red. You don't want to see blood. So if you see blood in the poop, you would want to give a call to the doctor as well. And, unarousable. You can't wake your baby to feed during those times, those windows. If the baby's not meeting those pee and those poo requirements in the beginning, that would be reason to call as well.
Right. I'm curious, as a pediatrician, when you guys take call at night and you get phone calls, how do you determine, like when you get, because probably, 95 out of 100 calls, everything's fine, you're good, go back to sleep, we'll see you in the office in 3 days, whatever it is. But periodically there's a real issue. And I would imagine in pediatrics, and especially newborns, the stakes are much higher, right? So how do you determine whether to be like super cautious and you bring every baby in and you won't miss anything, but then you're freaking every parent out, versus being sort of like chill and laid back, you're okay, everything's fine? I mean, like in different fields, it's different. Like in our field, it's generally not that complicated to figure out if something is straightforward or something is a problem. But I would imagine with babies, it's maybe harder. How do you do that?
I guess you just know what questions to ask, over time. For the most part, it's probably most of the time it's probably fine, and even if it's not fine, most of the time it can wait until the morning to be seen in the office.
Right.
So most of the people who are calling overnight, we wind up bringing into the office the next day, even if it's more to just reassure the parents because they might be really worried, So most of those people are coming into the office the next day. There's not a lot of things that we would be worried about in the middle of the night. I guess breathing would be one, right? So if there's respiratory distress, which sometimes we hear, we'll say put the phone to the babies, and so we can hear, croup is something that you can easily, know over the phone, or if, even like you can hear if there's respiratory distress. So oftentimes we'll do that. That would be, one of the things. But babies actually, to another point of what something that's common that freaks out newborn parents, is babies have a very irregular breathing pattern. So, in adults, when we're counting the respiratory rate, you count over 15 seconds and you multiply by 4. You can't do that in a baby. You have to actually look and count over 1 full minute, because they do this. They'll do like
Right.
So oftentimes if the parents call about that and breathing, then I'll tell them, unclothe the baby, take a look at the belly. Do you see the ribs sucking in? Do you see the belly like seesawing up and down? And most of the times the answer is no. And then your baby's, not in respiratory distress, most likely. I'll tell them, count over a full minute, tell me what that number is over a full minute, not just for the 10 seconds, and with those things, you can get a sense that most most of the time the baby's okay.
And also, I think most or many pediatrician offices are open 7 days a week in some capacity.
Yes.
For this exact reason.
Exactly.
If someone calls on Friday night, it's like, well,
come in the morning.
Otherwise, you have to go to the emergency room, and that's like, no one wants that.
Right. Most of the times we can get through, to the morning with our guidance with whatever that is. Look out for XYZ or, do, whatever as far as maybe an over-the-counter medicine or something where we're not sending them to the emergency room.
Right. And nowadays, also, when people do get sent to the emergency room, at least in most major cities, emergency rooms will have a specific pediatric wing, like a pediatric emergency room. So it's pediatricians. And I would say also most of the time people get sent to the emergency room, their babies end up being fine and going home.
Absolutely.
So it's just like we want to make sure sooner rather than later. Like if you go in the emergency room, does not mean like, oh my God, it's
definitely
just like,
not.
This is just something we're going to be up for 3 hours a night. It's going to be a rough night, but that doesn't mean anything bad's going to necessarily happen.
Yeah, that's why I like pediatrics, because babies tend to be fine. And kids tend to, even if they are sick, they tend to bounce back really quickly.
Right. Have you been, especially obviously with the pandemic, but have you been using any like Zoom and video platforms now because I imagine a lot of the stuff on well baby exams, obviously you can't listen to their heart and lungs, but things that you said like rashes you can see, how does a kid look breathing, all those things. Is that something, you could look at the poop, for example?
Yeah.
Is that something you've been able to incorporate into your practice?
Yeah, absolutely. We did. It was something that I was thinking about before the pandemic, but we didn't incorporate. And then as soon as the pandemic hit, we incorporated it and people love it. It can be really good for a lot of things and we use it and we're still using it now, for especially people don't want to come in or, it's a hassle to kind of, get out of the house with the baby, we can definitely do a lot on that, and even actually when in March and April when things were really bad and people really, were scared to leave, I had a lot of new parents who had scales at home and we would even do some of those weight checks, which in general I don't recommend because I find that having a scale at home, then the parents become like too obsessive about the numbers and you don't need to be weighing the baby every day and worrying about the day to day most of the time. So I usually advise against it, but it was helpful during the pandemic to be able to do that, especially too when people left the city and weren't around, you can kind of have that check-in, which was
as some people have said, those were unprecedented times. I've heard that term used periodically, just here and again. And then as they get a little bit older, like, maybe not the first couple weeks, let's say the first couple months, sort of same question. What are the common things that babies do that are weird, that freak parents out, but that are fine, that are normal?
Sure. So again, we talk about poop a lot in pediatrics, so I'll start with poop. But I always tell people at the 1 month visit, not to worry if the frequency of the poops goes down, because at 1 month, parents start to think their baby's constipated because they're just not pooping as often as they were in the beginning. But that's totally normal.
That's just their gut getting used to life and whatever.
Their GI tract is literally getting longer. They wind up, their GI tract is a little more mature and can kind of hold on to, what they need to and just kind of function, a little better. So as long as the poop is soft when it comes out and not hard like rabbit balls pellets, then your baby is most likely not constipated, So that's a common thing that comes up at 1 month of age. And then at 2 months is when they get the first set of vaccines, so then that's
a fun day.
Yeah. a lot of crying parents on that day. But I always try to tell them, you don't remember your first set of shots. Your baby won't either. It's okay. But what to do. That's when we start talking about how to manage fevers, because fevers then become very common, in kids. Although, again, not now. Most people aren't getting them. But in general, fevers are something that we can talk about at that 2 month visit. Because before the baby is 2 months and got the first set of shots, like I said before, you call the doctor if your baby has a fever. But at that 2 month visit, we expect that a fever might be a side effect of the shot. So we always go over the dosing because the bottle says call your doctor. So, so we go over that. We always have a dosing chart on our website too, because they always, the dosing is always based on weight, not by age, but they want you to check in. And then, going forward from 2 months, you don't have to call your doctor in the middle of the night if it's just a fever. You usually can give some Tylenol and see how the baby does and then check in, the next day. Most of the time we do want to see them if they're that little, for sure that next day, but if it's just that, people get so worried about fevers, but, I like to do a lot of reassurance that it's just a number, there's no number of it that is really going to harm harm your baby. It's your baby's, responding to something, and, it's a healthy reaction, and that's okay.
Right. Again, except maybe the first week or two of life.
Exactly.
In
the first 2 months of life, I would say that's completely different,
Right.
But then once that baby gets the first set of shots and we start to expect that a fever might happen, or they might, as a sign of the beginning of a virus, then,
Right.
Yeah.
Right. I was curious what your thoughts were, because we have a lot of parents ask us about, classes. People take classes when they're pregnant, and some of them are about the pregnancy and the delivery, and some are about like newborns, for example, like newborn CPR or like various parenting or whatnot. Do you find them to be helpful? Are you sort of neutral on them? You think that some of them are like teaching parents bad things? Like, what's been your experience with these classes?
Yeah, I mean, there's so many different things out there that, of course, sometimes I haven't reviewed the content of all of them, and sometimes, I don't know. But I think in general, I always think of it as like learning to swim, right? You can read up all you want about it. You can take all the classes in the world, but until you jump into the water, and do it, you're not going to really
choke a little bit. Yeah.
how to do it. But I mean, that being said, I think it's good to have that knowledge, because when you are preparing for the baby and you have the time, you can go through some of that, maybe, CPR, or maybe breastfeeding, or newborn care, or newborn sleep, or something like that, because you're not going to retain everything, right? And so you have to, generally, we all have to hear things a few times to really understand it and actually be able to do it. So I think it's the same kind of thing, that if you hear it one time, in a class before, then maybe when you're in the woods or, in the weeds and like need to know what to do, maybe then you're hearing it for the second time, or exactly, what book or place to go to, and that could be helpful.
Right. Okay. And then what about in terms of, you were saying the frequency of visits? What is the frequency of visits after that first visit? A few days after birth, because we actually didn't go. I'm just curious. What they are.
Sure. So it depends, of course, on all those the weight and the jaundice, where we might say come back tomorrow if we're really concerned about either of those. But once the baby gets back up to birth weight at 2 weeks and the jaundice isn't a concern anymore either, then we always do a 2-week checkup usually, and then we do a 1-month checkup, and then we do a checkup at 2 months of age. That's usually the first set of vaccines.
So like 2 days, 2 weeks, 1 month, 2 months.
2 days. Yeah. After 2 months, it becomes at 2 months, at 4 months, and at 6 months. And that is when you get the booster shots, the same kind of series of shots at 2, 4, and 6 months. And then after that, usually there's a visit around 9 months. And then it becomes about every 3 months after that for a little while until the baby's about 2 years old. And then it becomes every 6 months. And then every year.
It's a lot of visits. These are just the routine visits.
These are just not
include the coughing, sneezing, fevers, constipation, all those visits. So again,
or a flu shot maybe too, depending,
exactly. Which is why being close to the pediatrician is so helpful.
You're there a lot. Yeah.
And then, because you mentioned it before, I'm curious, what has been your experience, at least in your practice in New York City? What is the general attitude of your patients about vaccines? Is it something where they're all like lining up to get them, or you're like wrestling them to the floor to try to convince them to do it? Or is it like somewhere in between?
Most of our patients are very good and excited and want to get the vaccines. It is something that comes up in prenatal visits, where often they'll ask in a way that they want to make sure they're not coming to a place that doesn't vaccinate children, which I always love.
What's the code question?
I love to hear.
What's your opinion on vaccines?
And I could see in their face, the reaction that is a good reaction, where it's like, I'm happy to know that they're on board with the vaccines, you know.
And what do you do with parents who are not on board with them? How does that work? I mean, obviously you tell them what's recommended and why, and you go over with them, but what happens logistically when parents say, no, I'm out, I don't want to do it?
Yeah. So every practice is a little bit different. Some practices are fine with that. I personally am not fine with that, because if you're not going to vaccinate, then I don't want to put my other patients at risk.
Right.
And so I don't want, if you don't have any vaccines and then you have a fever, I don't want you coming into my office and putting my newborn babies at risk.
Right.
So,
unless, of course, they can't be vaccinated for health reasons.
Oh, of course. Yeah. But if you're just...
Which is rare, but it happens.
It's very rare. Yeah. It's rare, but yeah. So if somebody just completely chooses not to have, any vaccines, I'll say maybe it's not a good fit.
Do the schools even let them in without vaccines?
No.
In New York City, you have to be vaccinated, right?
You have to be. More common than people, completely refusing vaccines. I feel like, at least, in what we see is, people being a little hesitant, people having questions, and I'll guide them to resources to, read more about it, or wanting to do some sort of alternate schedule, which I'm not a fan of, but, sometimes within reason, I will
to
work
space
with.
them out. Yeah.
And I always say, like, first of all, there's no reason. Vaccines it's a debate in pop culture, but not in medicine. We don't have a debate about it, and they're very safe to give altogether the way it's been studied. And as a parent too, I actually find it to be nicer and better for the baby to just give the vaccines on the schedule versus when they want to draw it out and say, oh, come back in 2 weeks to do the next shot. And then the baby has a little fever, is a little fussy, has a sore leg, and then gets better after 2 or 3 days. And then you come back in 2 weeks and do the next one. And then the same thing happens. And then you come back in 2 weeks and you do the next one. And I just think that draws it out totally unnecessarily and causes more overall distress for the baby. And it's just not necessary.
Yeah. And I find also, I mean, it's such an interesting concept. And listen, I get it. I'm a parent and everyone's got their own feelings about their kids and what they want to do. And, God bless. And I think, though, that, some of it is maybe just there's a belief for whatever reason that they're not good. Or sometimes you can see that there's like this issue of control, that you want to have more control over it. And all right, whatever, like people do that. That's not the end of the world. But I think what people don't sometimes realize is even if it doesn't matter how the kid gets the vaccines or what schedule, or if you spread them out. And even if they're okay with the idea that my kid's going to have a fever every 2 weeks instead of every 2 to 3 months, fine. But the problem is, I think people don't always realize it when the way medical care works, if you go to a practice that's busy and seeing a lot of kids every day, and everyone in the office knows at this visit, we do this vaccines, it's not going to get missed. Right? It's like, there's no way a kid's going to get through your office through the 2-month checkup without getting the right vaccines, because your front desk knows, your schedulers know, your nurses know, the person who mops the floors knows, every single person knows. And when you sort of go off schedule and you do things in a weird way, sometimes things get missed. What if the kid is sick of the day of that vaccine and you're not going to remember? It's like hard. And you don't want to, like, I always tell people, it's like, would you ever ask your, quarterback to come in and start throwing lefty instead of righty? It's like, well, maybe they could do it, but why would you ever do that? They always do it righty. That's how they practice. That's how they play. That's how they're used to it. That's how it's going to get done. That's how the play is designed. That's where they look. And it's like asking your pediatrician to like do it lefty.
Yeah, that's a really good point. Yeah.
I tell people that when they ask me like a delivery, I'm like, listen, I don't do it that way. Like, why would you ask me to do it the way I'm not comfortable doing it? Like, I might be fine with it. Like, it may go okay, but I've been doing it the same way for 12 years. You want me to now switch? Like, it's just weird.
Yeah, absolutely. And I also think too, it's like, if you don't trust me that this is safe for your child, then maybe it's not a good relationship, because you have to be able to trust that I'm not harming your child.
Yeah.
Otherwise, then maybe, I shouldn't be your pediatrician if you think I'm trying to harm your child. I'm not. Like, I'm doing what's in the best interest.
Right. And you must be getting just pounded with COVID questions and COVID vaccine. And it just, it must be exciting.
Yeah, it's hard. I mean, it's hard. It's hard to navigate, for any one particular person and family, and then just over and over with. And things change so frequently, as you know, that it's like it's been interesting.
One of the fascinating things I found about COVID is sort of unlike other viruses, kids seem to do fine for the most part. It's like remarkable. It's like it's not the opposite of what you would expect, but it's unusual because we're always worried about kids, because they had less immune system and this, and even newborns. And obviously there have been a couple of cases of very sick kids from COVID, but it seems to be safer than the flu at the age of the kids you're taking care of.
I know. I'm so excited to find out why. There's so many theories and so many thoughts as to like why this is, and I can't wait to find out the answer, and it's interesting too, because maybe it'll shed light on, so for example, Kawasaki's disease, which is really common in pediatrics, and we've been seeing it for, we see it forever. And it's similar, it seems like, in a way, to the MIS-C that we're getting from COVID, right? And so Kawasaki disease, we don't know exactly what causes it and also, but I'm thinking, well, maybe we'll find some, it'll shed some light on that and other things, while we kind of learn more about COVID. I don't know. It's interesting.
Yeah, but I mean,
it's really interesting.
So, I mean, have you had a lot of patients whose kids tested positive for COVID either at birth or after birth? Is that something that comes up a lot or just pretty rare?
Yeah, no, not a lot. It definitely, we've had some, but it's definitely not a lot.
What do you tell parents about colic?
Oh,
that was another one that our family, we struggled with that.
Oh, me too. I did a video on it. Colic is so hard.
This is what it sounds like for a baby
video.
to scream for 5 straight hours.
Because I had a colicky baby and it's really, really hard, Yeah. So basically I, kind of have a checklist to go through what the baby's, things you could try when the baby's crying, right? Of course, you want to make sure the baby's well fed and all that stuff. And you go through this checklist of what you can do. But, if you truly have a colicky baby, it is so hard. And I like to tell the parents a few things. One is it will pass, know, and just reassure them that it will pass. And that's kind of the beauty of newborns and pediatrics in general, is that babies change so fast. So no matter what it is, whether it's that like wonderful snuggly period where you're smelling them and you love it and it's wonderful, or if it's this colicky period where you just don't know what to do, no matter what it is transient and you will get through it and your baby will change. So it will pass, and just to, find that support that you need and take care of yourself. And I think this goes back to really trying to teach the new mom to take care of herself, because, it is okay to put the baby in a safe place, a crib, a safe place, make sure that it's a safe environment. There's nothing around. It's a safe environment. And then walk away and let that baby cry and do what you need to do. You can cry. You could take a deep breath. You can call your friend. You could put earplugs in. You can do a dance, listen to a song, do something. And, it's fine that your baby's crying and you need to take care of yourself, and support from other people is really important. And, to be able to, I remember so many times of, when I had a colicky baby and my mom would show up at my, door and I just would hand her the baby and say, here,
we out
here. Here, but to be able to give somebody else the baby for a little bit so that you can go for a walk, get out, do something. It's really important and it's okay. Like, it's okay. It's not, you still love your baby. You're still a great mom. Your baby loves you, and take that break.
Yeah. That was definitely the best advice we got after, months of this. Like, every night with one of our kids from like 7 p.m. till midnight, it was just like scream time. That like every day. And then eventually, John Larson's he's like, put her in the crib, close the door.
Yeah.
we're like, wait, are we inside? He's like, no. You like put her on one side of the door, you're on the other side. He goes, that's it. He goes, there's nothing wrong with her. Just do it. Then actually she fell asleep. And actually after that, she was like sleep trained. But it was so true. He's like, there's nothing wrong with her. She's not, she's not being hurt. She's still, if she's screaming when you're holding her. So just put her down, close the door. And I think that's a really good segue, because the last thing I wanted to talk to you about is this idea of the role of the pediatrician in the care of the parents. And I'll go specifically with the mother, even though it is the parents, but I'll talk with the mother because, I do women's health. And, obviously we as obstetricians, we take care of women during pregnancy and beyond. But the interesting thing is, from the time they get discharged from the hospital, we typically don't see them till 6 weeks later. Sometimes we do, but usually not. We have no contact. And they're seeing you 1, 2, 4, 6, 12 times. And so in a certain sense, you're the doctor that they see in that postpartum period when so much can happen physically, emotionally, spiritually, family relationships. How do you view your role? Because you're the doctor for the child, for the baby, but you have this other person. Again, it's not always the mother, clearly, but we'll talk about her, who's coming in to see you. How do you view yourself as one of her providers potentially? Is it sort of like a direct role, or are you just sort of like peripherally, or are there things you formally screen for or informally? How do you view that? I was always so curious about that.
Yeah. One of the things I'm passionate about and I love to talk about is the 4th trimester. And that's really how I think of it, right? And so it's like that 3 months after a baby's, born, where the baby is learning how to live in life. But really it's the mother is adjusting to this postpartum period. And it's just it's such a special, unique time. And it's interesting how cultures around the world, I think we in the US do such a bad job of taking care of that 4th trimester, mom. As a culture, we don't support her as much. We expect a lot of her. We expect her to host family, we expect all these things, where other cultures have this like defined name for the period. It's like usually about a month or 40 days, and they, all kind of take care of her too, So I think it's really important. I mean, so formally what we do, we do depression screening. The mom has to fill that out at basically every visit in the, in the first month, and then at the 2 months and
but that's
4 months.
I mean, that's fantastic. I can't stress how important that is, because a lot of women have postpartum either like a clinical depression or something, let's say, less severe than that. People call it the blues or this or whatever, but some form of that. And they don't always know it's abnormal. They just think like this, I'm supposed to feel miserable all the time. And they say, oh, it's because I'm tired or because I'm hungry or because I'm in pain. And they're not screened. So, and I don't know if all pediatricians do that or not, but it's so important that you do that. And it's critical because you're seeing them and you can really intervene or lead them to someone who can help them early. So that's great.
Yeah, I think most do. I mean, it's American Academy of Pediatrics recommends it. I mean, I think most do, and we're seeing them so much that we know we develop that relationship with them where we know, what to kind of ask for. And it's so important.
Yeah. Are there other things that you either have seen or look for or talk about, even whether it's formally or informally, that comes up that you sort of give a heads up to them or to the OB or to somebody else? Hey, like this, something needs to be addressed.
Breastfeeding is something we do a lot of. I actually just got my IBCLC.
Great.
And so it's something that me and one of my partners actually started doing during COVID was lactation consultants too, in our office for our patients, because that's such an important part of the beginning.
And they couldn't get someone to come to their home.
And they couldn't get someone to come to their home. So we started to do it at that time. And it's really, it's really helpful because that is such a struggle of the new mom physically, emotionally, feeding her baby, and to be able to help her with that is really is really great.
It's so fascinating. I was just thinking about this. Everyone, when we go through either sort of in pop culture or even in medical school, everyone thinks like, oh, the people who go into pediatrics have to be good with kids. Well, no, they have to be good with parents, right? I mean, you could be horrible with kids. You could be terrible with kids, but if you have to be good with parents, because that's really the relationship of the, with the pediatrician until whatever it is, 10, 12, 13, when the kids sort of start, getting a relationship with the doctor on their own that's meaningful, not just like cute. So for the first, 5 to 10 years of life, that relationship is parent or whoever the caregiver is and the pediatrician. And so when people are looking for a pediatrician, you don't, if you think, oh, this person's going to be great with my kid, say, is this person great with me? Right? Because sometimes people who look like they're great with kids might annoy you, or something, or vice versa. And so that's really the important thing. Is this someone who I can trust to talk to about concerns I have with my child, or if I'm not doing well or whatever it is? And that's such an important point I think people miss all the time.
Yeah, I think, they don't really think about it so much, but we really are, directly talking to the parents all the time, and I'm always checking in too about, the new mom about if she has seen a mental health provider, if she's seen one before, and, and doing all that.
It's amazing.
It's a special time. It's, that fourth trimester, and it's a lot of change for the mom.
That's great. Is there anything else that just talking about the first 3 months in that fourth trimester that you think parents should know about, or stuff that you routinely cover that maybe we didn't go? We're certainly gonna have you back because
so fun.
Childhood goes forever.
Yeah,
I'm still a child and probably should be seeing my pediatrician, but there are those who maybe call it at 18. And so we're gonna talk about all of that. But is there anything else that you wanted to cover today?
I mean, I think we got a lot of it, but I guess the one thing maybe I'd just like to say is like it's overwhelming, when you're a new parent, and people give a lot of unsolicited advice, whether that
so
be
helpful.
Family or friends, and also online, on social media, on Google, on whatever, you just find so much stuff. A lot of times it's super conflicting, and so I like to tell new parents, just pick one or two people that you trust to listen to. It probably should be your pediatrician, maybe your mom, maybe your best friend who has a few kids, or maybe not, maybe someone else, who knows. Pick a few people, probably not more than 2 or 3. Listen to them, and even take everything they say with a grain of salt here and there, but listen to them as your guide, and really just ignore everyone else and just say, okay, thanks, and move on.
That's great.
Yeah.
That's great advice. Tracy, thank you so much for coming here.
Oh, thanks for having
coming
me.
and talking. This is such important stuff, and I really appreciate you coming, B, all your helpful, advice and recommendations and information. And obviously it's very clear that you're good at communication, you're good at explaining things, you're good at talking to, and I could see why parents would really like you as their pediatrician.
Oh, thanks. Thanks for having me. And I'll share with you too. I have a planning guide that if your patients want. Yeah, it's to prepare for the fourth trimester while you're in the second or third trimester.
That's
I
awesome.
Can share it with you if you want.
Thank you so much.
Yay.
All right. Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only. It does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.